Hey, my name's Luke, and my job here today is just to get you out of acute lower back pain. Now, almost every person on the planet is going to experience back pain at some point, but if you're watching this video, more than likely you've got an acute flare-up or you're looking for solutions on how you can get rid of your back pain. And this video is going to take you through that. Before we get straight into the solutions, I just want to quickly take you through a tiny bit of anatomy. It's going to be very brief just to explain what's the cause of your pain, because if you don't know what the cause is, how are you going to know how to fix it? So to start with the pain, right, we'll start with our anatomy, We're going to look at our spine. Now, our lower back is comprised of 5 lumbar vertebrae, or 5, 4, 3, 2, and 1. And in between these vertebrae are these spinal discs. And discs act as shock absorbers. They help take the load, and it helps distribute the weight coming down and the ground reaction force coming up. At the back of the vertebra, we have what looks like melted wax, but there's 2 little facet joints on each segment. And these facet joints are designed to facilitate movement through the spine. More than likely, most back pain we see coming to this clinic is either a disc sprain or a disc bulge or a facet sprain. And both of these are going to lead to an acute muscle flare-up or an acute muscle spasm. So primarily, some practitioners will tend to focus on releasing the muscle spasm and sending you on your way. Others will focus straight on trying to get you out of pain with exercises and stretches to try and relieve the muscle spasm. Our goal today is to try and free up the spasm that's going on in your back, create movement through those joints where there is none, teach the brain that it's okay to move, that we don't need to freak out and panic so much, and also to try and activate the front so that we can take the load or spread the load evenly between the back and the front of the vertebra. So you can see behind me, there's a picture of the musculoskeletal system. With the muscular system, there are 2 primary slings that happen in the body to stabilize the lower back, and they form an X. The first is an anterior sling and the second is a posterior sling. Now with the anterior sling, you can see here our adductor muscles, which are groin muscles, the fibers of them tend to follow up and combine or unite into our oblique muscles. So you've got this strong oblique sling at the front on each side, and at the back you can see our glute muscles, the orientation of the fibers blend into the lat muscle, okay? So we've got this nice strong X at the back and nice strong X at the front. In your acute pain, more than likely what's happened, the back sling has locked up to protect itself, and the front sling has turned off or is on stretch, which means the muscle's not going to work efficiently and we need it to work properly. So what we're going to do, the techniques I'm going to show you are designed to release the back sling and activate the front sling. Okay, so for our first thing to get us out of pain, we're either going to use a trigger ball, a golf ball, a tennis ball, or a spiky ball. And what we're going to try and do is release the muscle spasm that is in that posterior sling. So that will be our glutes, our lower back, and our lats. And this is going to be a very gentle technique, and you can do it as much as you want. So I'm going to use the trigger ball to demonstrate what to do. So you can see that I'm lying down on my back. There's a pillow underneath my head and my knees are bent at 90 degrees. I'm going to take this little trigger ball. I'm going to either gently roll to the side. If that's hurting too much, we're going to lift our hips up and that ball is going to sit underneath my lower back on my right hand side. And from here, I'm just going to relax my body weight back down onto the ball. And I'm going to do some gentle rotating left and right with my knees. And I can do this for a minute. Or I can start to gently roll the pelvis back and relax. Roll the pelvis back and relax, almost like you're doing a pelvic thrust, but as you're doing this, the ball is in the sore spot. Or if that's too much, just lay on the ball and let it just slowly start to turn that muscle off and release that muscle spasm. And you can do this anywhere along your spine. Once we've done that, we can use that same ball and release our glutes that are also in spasm. So we're going to take that ball, it's going to sit underneath our glute this time, and that same foot where that ball is going onto my opposite side. So I'm going into a figure 4 position, and I'm gently going to roll onto that ball. Or I can scoop the pelvis up and let it drop down. So the whole point of this is really just to act like someone's elbow driving into that lower back or into that glute. The last thing we're going to do is similar to what we did with the ball, except this time it's a stretch. So we're into that position, 1 foot on the opposite knee, and you're going to lightly either press that knee down to increase the stretch through the glute, or you can pull that knee towards the opposite shoulder to once again increase the stretch through that glute, because more than likely with your pain, it's referring into your glute. Okay. So to activate the front sling, we're going to do a couple of things first. We've just done a couple of stretches to get us out of pain. We've worked on the trigger ball to release our lower back and our glutes. Now we want to try and activate the front. So we're going to start in what's called a 4-point quadruped position, which is this position here. Now, because you've just released the back, you don't want to do anything that's going to flare it up or create more pain. So what we're going to do is gently arch up, and we're going to gently drop down into extension. And you can see my movements are quite slow. I'm not aiming for a full range straight away and a full extension straight away, because the muscles will go straight back into a spasm. We've just released them. Let's take it easy. So from here, we're going to do a small little arch up, and you'll feel a little stretch in your lower back. You can also see I'm tucking my pelvis underneath. We're also going to do a small little extension. And then we're going to try and find our halfway between these two movements. Once we've found our halfway, we want to do a small little pelvic tuck starting from here to gently lift the pelvis forward. Okay, so I'm not trying to flex through my back. I'm doing a small little pelvic tuck just to engage those lower abdominal muscles. And to engage our pelvic floor, I'm going to imagine that I'm trying to hold wind in, but I don't want to do a fart on someone behind me. Okay, so I'm going to engage those muscles to hold the wind in, and you might feel a little contraction around your private region. So we've got a small tuck, I'm holding the wind in, and my first exercise is I'm going to try and draw my knees together, but I'm not actually going to move them on the bed. So I'm going to tuck, I'm going to hold wind in, and I'm going to draw these knees together, and I'm going to hold them together for one breath, and out. And then I'll relax. Okay, and what this is doing from our slings before is we're starting to unite the oblique muscles with our adductor muscles. We're getting that front sling active again. So once again, we do a little pelvic tuck, right? We hold wind in, and I gently try and draw my knees together, but I don't actually move my knees. To engage the obliques, I'm going to take my right hand and I'm going to try and draw it to my left knee. So I've got the tuck, I'm holding wind in, okay? I'm squeezing the legs together, and I'm now in sort of this movement, going to try and bring that arm down to that knee. I'm going to hold for a breath, and down. And then I'm going to repeat with the other side. My left hand, I'm going to draw to my right knee. The whole time, I'm still squeezing these adductors together, or these knees together. I've still got my pelvic thrust, or I've got a little pelvic tuck happening, and I'm holding wind in. And then I'm going to let go. This time, I'm going to try and do both and hold it for 5 seconds. So I'm going to squeeze the knees together, pelvic tuck, holding wind in. I'm going to try and pull my right hand to my left knee, my left hand to my right knee. I'm holding for 5 seconds. 4, 3, 2, 1, and I'm letting go. This time I'm going to do it under breath. I'm going to breathe in. As I breathe out, 5, 4, 3, 2, 1, let go. And you can repeat this 10 times. Okay, for the last thing that we're going to do, it's a hip flexor stretch. So you can see I've placed my knee on something soft like a pillow. I've got a desk here or a bed here just to hold myself so I don't lose balance. I'm going to start by standing nice and tall. And you can see, even though I'm facing the camera, with my left knee forward, my hips are now twisting and facing towards the desk. I want to make a conscious effort to draw that hip forward. So you can see I'm twisting through the hips. I'm not twisting my shoulders. I'm twisting through the hips to be facing the camera or square on with my shoulders. I'm also going to do a small little pelvic thrust or a small little pelvic tilt like what we did with our previous exercises. And you may already start to feel a stretch through your hip flexor / upper quad. My left leg is pushed as far forward as I can tolerate. And from here, I'm going to hold onto the table. I'm going to breathe in. And as I breathe out, I'm going to put pressure on this knee. So I'm physically shifting forward, but I'm not extending my back. I don't want to set off that muscle spasm again. I'll show you an image from the side. My knee is on the pillow. My leg is in front. I'm squaring my hips up. I'm doing a small little pelvic thrust. So you can see I've lost that extension through my lower back. And my weight goes forward on that knee, but notice that my lower back is not changing shape. I'm not extending into it. I'm not slouching over it. I'm maintaining a neutral spine. I have a pelvic tuck. I've squared my hips up and I'm leaning forward. I'm going to breathe in. As I breathe out, I'm going to go further forward, noticing I am still not changing my lower back position. The last stretch we're going to do is for our lat muscles. Remember, we're releasing that posterior sling. So we've done our glute work, we've released with the ball, we've activated our front. We now just want to finish by releasing our lats. So I'm going to stand facing a door. My hand is going to grab hold of the door handle. And you can still see I'm protecting my back. I haven't gone into full flexion here. And from here, I'm going to breathe in, and as I breathe out, I'm going to pull through the hips, imagining that there is a hook attached to the back of my pants and someone is pulling my pants back. So I'm going to breathe in. As I breathe out, I'm going to slowly have that person imaginarily pulling on the back of my pants, and you can see I'm starting to get a nice stretch through this lat. I'm going to breathe in. As I breathe out, my right hip is trying to go further and further and further back as I stretch through this lat muscle. To come up, we release the stretch and I drive through my heels to come up into a standing position. Now, as with all medical advice, this does not replace medical advice, this does not replace health advice, this does not diagnose, treat, and whatever other mumbo jumbo you want to use. But at least you've got a couple of tactics to get you out of pain. And once you're out of pain, you can then do something about it. So if this is you, or if this is someone you know who does have acute lower back pain or can barely get off the floor or are really struggling, please feel free to forward this to them. They can also make contact with us. We've got a website, kthealth.com.au, and there's a hyphen between the KT. So kt-health.com.au. We're on Facebook, we're on the Instagram, we've got a website, you can message us, we've got a phone number, 9056-3332. We'd love to reach out, or we'd love to help you if you're in this position. What I've given you is more of sort of a management strategy, but we probably still need to get to the root cause. So we'd love to help you out. Give us a call today. Otherwise, enjoy the rehab exercises and let me know how you go.